Hey everybody, welcome back to the Dr. Terri Show. Are you tired of being tired? Tired of not sleeping at night? What is going on? Or I can only sleep with medications or some sort of, PM medication or something. If you are having struggles with sleep, you do not want to miss today's episode. I am in the studio with Dr. Jim LaValle. Again, it's our favorite topic, one of our favorite topics, definitely Dr. LaValle's favorite topic, because without a good night's sleep, nothing else works. So if sleep is an issue for you, or you know somebody that has issues with sleep, join us in the conversation today. It's going to be great. All right. Welcome back, Dr. LaValle. We're in our same clothes because we just are going to go right into the next episode because we have to talk about sleep. Sleep is, the most important. And I think even as we get older, I've even noticed over the past, 20 years, probably 15 years, chasing sleep has just been, it's almost an obsession, and I never had to take things for sleep before, but I think it's just the stress, the life, the lifestyle that we lead, that we're going and blowing. And there's a couple of things I really want to talk about because I heard you teach on this at our last conference together. That was very interesting to me. Number one, I want to hear everything you have to say about sleep, but you said something really interesting about if you sleep really well by taking a Benadryl, then something's going on in your body with regards to histamine. So I think there's so many things that people, because there was a season there that Tylenol PM was the only thing that was going to put me down, and I just thought, this can't be good for my gut to take this all the time. I got to figure out something else. And then another one a lot of my patients ask me about that I don't know a lot about yet is the cannabinoids and the cannabinoid system and CBD gummies and all these things. So let's just dive into all things sleep, because without it, we're not very good functioning humans to each other mentally or emotionally, but also just our body and repair and recovery.
Yeah, well, first of all, I think it's the number one thing I deal with people. Yeah. I don't know. There's not many people that come in and say, hey, I don't need any help with my sleep. I sleep 7 to 9 hours restfully every night. I wake up and I feel great. I feel awesome.
Teenager.
Right. Yeah. Or, if you got coyotes in your backyard, like what happened to me the other day. So the first piece is it's an epidemic issue. Yeah. It is really a big problem because we have light pollution.
Yes.
Our brain.
I want to talk about that.
Yeah. Our brain perceives light. We get in our house, we work a long day and we get in our house
and on all the lights.
Every light in the house gets turned on, right? Yep. And your brain's going, wait a second, I thought it was going into night here. And then it's really hard if you're driving on the way home. You've got, lights coming at you in the other direction on the highway.
It's confusing to the brain.
Very confusing to the brain. And your brain works by a circadian pattern, right?
Hey, and what about people that go to sleep scrolling on videos and on phones and the worst?
Oh, that blue light pollution. Yeah. Sure, absolutely. And we wonder why we have sleep problems. So there's that light pollution issue. And then there's the stress issue. When our body feels like we're in fight or flight all day long, it doesn't know how to turn off at night because we're still releasing too much cortisol into the evening. And your body has this pattern that it likes to run in. And you have a master slave clock in your brain. It's called the suprachiasmatic nucleus. It's your body runs by a series of clocks. And when you're not sleeping well, the clocks get screwed up. Mm-hmm. And you're going to throw off how you release your hormones. Mm-hmm. All your hormones, including insulin. Mm-hmm. And, we wonder why we have a population of people that are insulin resistant and, pre-diabetic, diabetic, overweight people. I really believe part of it's sleep. And then you
sleep in the gut.
Sleep, yeah. And then you look at sleep apnea, big problem. And so the first thing I try to get across is if you're waiting till nighttime to take something for sleep, you're not really conquering your sleep issue.
Nice. I love that.
That sleep, if you look it up, it's called a disorder of hyperarousal. Your brain's taking on too much stress during the day and you're not able to offload that stress at night.
And taking on a lot of stress, but also we take on a lot of stimulants to keep going past.
We do. Caffeination.
Yes.
Yeah, without a doubt, right? I mean,
energy,
because we need it to get through these days that we overpack. And also what we perceive as a white tiger is now an email or a text message, or I'm late for an appointment, or I've got one more thing I put on my list, and they're not life-threatening. So it's not to that degree of the white tiger, but it's still a tiger.
Mm-hmm.
And
your
so
body's responding as if there's a tiger.
Your body just thinks, hey, I need to keep pumping out more of my sympathetic nervous system, meaning you're more adrenaline, more noradrenaline. Well, what's the problem with that? Your body's supposed to make a pretty good chunk of cortisol in the morning. Then it's supposed to drop at noon. Then it's supposed to drop again at 5 or 6 p.m. And then it's supposed to go to almost nothing at bedtime. And then you release melatonin, which helps your body be able to go into REM and that deep wave sleep that helps you restore your brain for the next day. So the first thing that I try to get people to understand is you need to somehow manage that stress during the day. And so if you can't do that because maybe you're working 2 jobs, or maybe you're just in a position of high responsibility and you've just got a lot that's churning during the day, well, then you need help. And that help could be, hey, and I teach this all the time. Maybe you need to do box breathing. Take 3 minutes.
I knew that was coming because I could feel my body start to take a deep breath.
Yeah, take a deep breath.
Every time you talk about it.
Exhale. Well, it's crazy, right? Your watch is telling you when it's time to take a deep breath nowadays, right? That's insane to me.
Every time you talk about it, I stop and I realize I'm holding my breath. We hold our breath so much.
I'm the one thing I'll say about wearing a sport watch for me that's been great is I look at where's my pulse rate at? Mm-hmm. Because I know if I'm keeping that heart rate low, that I'm staying out of sympathetic tone. And that's one thing that's keeping me out of sympathetic tone. Because I thought I turned that thing off. But you know what? That's all those Medicare calls that keep coming in that I told you about on the break. So the first thing is just simple box breathing, 4 seconds in, hold 4 seconds, 4 seconds out, unload the stress. Think about the stress you're letting go of in that 4 seconds out. Hold 4 seconds. Just do it for 3 minutes at lunch. Yeah. 3 minutes when you get home from work, 3 minutes when you go to bed. That's the first layer. How do I get my body's parasympathetic nervous system turned back on? Because it's very hard for people to take a half hour and, you tell me, take a half hour and meditate. People go, if I had a half hour, I'd be in great shape, And so that's number one. And number two, we always culturally, when you look at traditional medicines, took adaptogens. Mm-hmm. Adaptogens are what helps your body defend against stress. It keeps your nervous system in check. Most people are past adaptogens even helping them. So I know for you, one of the things that you love is a compound called Quicalm.
Love Quicalm.
Which is 3 herbs called Relora, theanine, and holy basil. So I tell people, if you're feeling like you're overcommitted, if you're feeling stressed, if you're feeling anxious during the day, utilize a botanical extract to help you stay calm during the day so you're more prepared to go into your night. Because the big thing people do in our culture is they rely on sleeping pills.
Yeah. Or alcohol.
Or alcohol, right?
Or
I only drink, sleeping pills and alcohol. The magic combo, right?
Oof.
And the interesting thing is I only drink a glass of wine becomes I only drink a double glass of wine. Now I drink a goblet of wine, and then I get my big gulp. I drink a bottle, or my partner and I, we split a bottle of wine each night. That's all. and we know now.
What's wrong with that?
I'm not going to comment. Because the thing that's interesting is now that people are wearing Whoops and Aura rings and Ultra Human rings, they're noticing, when I drink that alcohol,
you're not sleeping.
I'm not sleeping as well. And that has helped. But a lot of people end up taking a sleeping pill.
Right.
And that's either in 2 categories. One is the antihistamines. So taking a Tylenol PM and you're taking, diphenhydramine or some sort of antihistamine. And when you're taking that, that means your body's making too much histamine. Yeah. Histamine is very excitatory to your brain. And maybe you need to look at your gut and find out, are you eating foods that are helping you to trigger baseline histamine? Is your immune system ticked off for some reason? Mm-hmm. But then they reach for the benzodiazepine. So people then start taking drugs like, yes, absolutely. They take Ambien. Mm-hmm. And now we know, the latest study that came out, that if you're on those benzodiazepines, it actually increases your dementia risk quite a bit.
Yep. And they're so hard to get off of.
They're very difficult, right? Because there is an addictive quality to them. And the other interesting thing is that category of drugs depletes melatonin. And then as you're aging, a lot of people in the geriatric population are also put on beta blockers. And you can talk to any gerontologist. Anyone that's in the geriatric population and they're a healthcare provider will say, I know that person's going to come back to me for a sleeping pill within 6 months of being on that beta blocker. And why? Because you deplete melatonin. Now, why is that so important? Because when you deplete melatonin, you're not allowing your body. It is the signal. And there's other things involved like delta sleep inducing peptide, DSIP. There's other components to getting your brain to calm down. So, we'll give that. But we know that melatonin tells your brain it's time to repair. Yep. And so after months of being on a benzodiazepine, and you know this, being a practitioner for a lot of years, people come in and go, I'm not thinking as clearly. Mm-hmm. I mean, that quad Americano or that super latte I just got, it's not doing it for me. And I'm feeling foggier headed, and I'm feeling like my short-term memory's going. And I'm even getting food cravings, like the Ambien, the middle of the night raids on the refrigerator that people forget that they did, right? Mm-hmm. But that's occurring for a very specific reason, and that's that loss of melatonin. So when you think of hyperarousal, there's several things that go on. One is you could have a genetic vulnerability to it. If you were in your mother's womb and your mother was anxious, more than likely your nervous system is patterned that way.
That's interesting. Are you looking for a healthcare provider who understands the importance of integrative medicine? Evexias Health Solutions is changing the way we approach wellness. We train practitioners on cutting-edge therapies focusing on a preventative care model. If you're ready to take a proactive approach to your health, Evexias can help you find a provider who's right for you. Just head to Evexias.com. That's EVEXIAS.com and click on the button Find a Provider to find a provider near you. Talked about QuiCalm earlier, and QuiCalm has been, it's now our top selling supplement in our office because everybody's so stressed out. And I tell you, I have had patients where I went to the front, got a bottle of QuiCalm, opened it up, said, take 2 now, and I'll be back in 15 minutes. And seriously, they have responded that better than Xanax. Everything tampons it down.
Right.
You said something important about melatonin. And I just spoke at A4M on melatonin. It is one of my favorite lectures because so many people just think melatonin is for sleep.
Right.
Well, it doesn't make you sleep. It's released when you sleep. But what it is doing, and you said it, is it's a powerful anti-inflammatory. It's a powerful immunomodulator.
Exactly.
And low melatonin, because of light pollution and night shift workers, we see this, and benzo patients and beta blocker patients, and so many that are on both, they are higher risk for cancer because there's a direct correlation between low melatonin and increased cancer rates. So,
especially in breast cancer, right?
Yeah, absolutely.
Unbelievable in breast cancer.
Top one is breast cancer, especially in night shift workers. So, I can't underscore the importance of melatonin. And if I have patients that their PCP gives them Ambien, I try to get them off. I have been able, for people that really are committed and really want to, I can give them high dose melatonin and gradually do an every other day, and they'll eventually. Right. It takes a long time. But the other thing about melatonin that's interesting that I found is it's amazing for blood pressure.
Right.
And when I was using a lot more melatonin during COVID, I was having patients coming, I haven't had to take as much of my blood pressure medicine.
It makes sense though, right? Because if you think of that circadian timing where your sympathetic overdrive, now it's getting turned off. If you stay in sympathetic overdrive, you're making too much adrenaline, noradrenaline, your blood pressure's up.
Yep.
And that's why I'm always passionate about, hey, what's your morning and night blood pressures? Or is your blood pressure going down a little bit at night? Because if it's not going down a little bit at night, you're probably in sympathetic overdrive. And, melatonin's got these great antioxidant properties. And to your point, I know on our previous, episode, we talked about the immune system and flu and why sleep is so important. Melatonin plays that role as really helping your immune system to be able to surveil and patrol because you have adequate sleep. And so there's a genetic vulnerability that's there. And then there's the lifestyle vulnerability that's there, meaning, hey, I'm using a lot of caffeine. Maybe I don't metabolize caffeine all that great. And so I'm staying more kind of jacked up because of the caffeine that I've taken on. And then there's time of life. You enter menopause. You lose your estrogen.
Well, everything lowers as you age. Melatonin, DHEA, all your hormones. I mean, it's just rude. Like, you can see the curve.
Believe me, I know this. I know this.
You got to start replacing these things. And, you talk about sympathetic overdrive. And I had a patient one time who's like, well, what does that even mean? We're using these fancy words. And I said, it's like if your car is in park and you just have your foot on the gas and it's just like, you're not letting up off the gas.
That's exactly
And that does, as guys know, car aficionados know that's not really good long-term for the engine.
No, it's not. And I think, when you start to look at it's a vicious cycle that happens, right? Because say you're genetically predisposed, then you got light pollution layered on top, then you're 55. And look, men that go into andropause, same issue with sleep problems or DHEA pool goes down, but women in particular.
Deficiency is a huge cause of lack of sleep. And it's one of the first things that patients say return after they get their testosterone levels back up into that optimal range of sleep. Oh, yeah, absolutely. And then another factor, of course, is getting your growth hormone back. Yeah. So using things like sermorelin, which is a peptide. Hopefully soon CJC again.
CJC, ipamorelin, let's go. But, the reality is, how many times do you start giving that because people, hey, I want to get my GH levels back a little bit, improve my body composition, get a little more lean mass. But the first thing they report is, I'm sleeping so much better. And that makes sense because once again, your body's supposed to release that growth hormone at night. It's playing a role in that brain rejuvenation as well. And so that's an important piece. But what happens when you get stuck in this cycle is now you're not sleeping. And then when you're not sleeping, there's a fear of sleeplessness.
Oh, it happened to me just last weekend.
Right? It's like, oh my God, I've got to sleep.
5 hours. I got to get up in 4 hours. My lecture's in 2 hours. Oh my gosh.
Well, I know for me, if I have a flight where I have to get up before 5 a.m., it could be I have to get up at 4:55 a.m. Not 5, but 4:55. As soon as my brain hears before 5, I'm sitting there going,
all the way down.
Okay, I wake up, I look at the clock, oh, it's 1:45. Okay, I can sleep. 2:45. Oh, I can sleep. And then it's just that, right? And that fear of sleeplessness then drives core anxiety, which then feeds into that cycle.
Do you get up and take a quiet calm?
I you know what I do, honestly, is I've got melatonin by my bedside, and I'll just chew up 5 or 10 milligrams. And
I have a liposomal, we have this in our clinic, liposomal melatonin spray.
Yeah.
And I just...
Exactly. But I think, once again, going back to what can you do, I think a lot of times people think, oh my gosh, I'm just going to be sleepless and I have trouble sleeping and I wake up at 3 a.m. and I start making my list. I may as well get up and work because I'm not going to go back to sleep, because the first thing that happens is when people wake up at that 2 to 3 a.m. hit,
you're like, ting.
Yeah, ting. Okay, I'm going to start thinking about work, what I got to do the next day, where do my kids got to be, what am I doing on vacation in 6 months, what do I got to pack, right? It's all that goes on. And the reality is, you have to work at your sleep hygiene.
Yeah, love that sleep
and I
hygiene.
think that is one of the biggest problems that people have
It's
is
not
they
being
don't.
talked about. This is if you go to your primary care doctor and say, I'm not sleeping. Okay, here's your script for Ambien. It's not, there's no conversation about sleep hygiene. In general, I'm sure there's some amazing clinicians that are more authoritative. They're speaking about it. I don't want to make a blanket statement. But that's how people get to us. Primarily is sleep.
That's I have to agree. It's the biggest thing I've dealt with over the last 40 years. And so I think sleep hygiene, when you start to think about that, it does start with that. Think about unloading stress during the day. If you're feeling overcommitted and stressed, take something during the day like Quiet Calm to calm the nervous system, but not make you groggy. So you're not going to feel groggy. Take some melatonin for that anti-inflammatory, immunomodulating, and signaling your brain it's time to go down. But then there's other things you can do. Take an Epsom salt bath, for example. Get some lavender oil.
Every night.
Yeah, that's awesome. Put a little lavender oil in there.
I started doing those Epsom salt lavender baths years ago because it's the only place that I could get that my kids knew. Do not bother me while I'm in the bath.
And don't take your phone in there.
30 minutes. No.
Yeah,
Nothing. A book, maybe.
They've got those attachments now where you can stick it on the side of the bath and you can have your phone in front of you, right? I mean, come on. Don't buy that. And so like things like...
It's ritual, right? I mean, it's ritual. Humans by nature love rituals. So this ritual of getting ready for sleep, and for me, that starts like at 8:00 at night.
Yeah.
And people tease me about it. You're going to bed at 8. I'm like, I'm getting ready for sleep at about 8.
Yeah. Well, no, I think that's the right way. The way I've looked at it for a long time is when you look at how your body repairs, really between the hours of 10 p.m. and 6 a.m. is when your body's in what's called in Chinese medicine, your Shen cycles. Well, now in Western medicine, we're talking about circadian timing of everything. And it turns out Chinese medicine was right. Your body's doing a lot of repair at bedtime on all these different organs. But one of the big things I see that happens with people, they feel themselves getting sleepy at 9 p.m., but because they've worked a long day and the kids just went down maybe at 8 p.m. because they're younger kids, because forget about that if they're teenagers, but they just went down and they feel like they're being cheated of their free time.
Whatever that is.
So, whatever that is, right? I want to watch a show or whatever, I got to get on that next series, I want to watch Landman, right? The new hot one. But the bottom line is you fight through the natural signal that your body's saying, hey, you're sleepy. You're sleepy, dummy. Go to bed. Well, and you fight through it.
That's because I used to think it was because I worked night shift for so long in the hospital. But if I stay up past 10 o'clock, I'm up. I mean, it's going to take something to put me down. And I thought it was just because my body got used to, that 11 to 7 shift or that 11 to 7 shift. But maybe it's just this. I pushed through that signaling time.
I think it happens a lot with people. I mean, it's interesting because I know I feel it. If I just listen to my body, I should go to bed by 10 p.m. Naturally, my body's telling me you should go to bed. And
I'm 8:30. I'm lame.
Well, no, that's great. That's awesome. For me, I've always been able to I don't want to say get by. I feel the most refreshed. I try to identify that. Yeah. If I sleep 7 hours.
Yeah, it's kind of the sweet spot.
That is my sweet spot. If I'm short of that, it's probably not going to be quite so good.
And too much can make you groggy.
It can. And I have to say that I'm absolutely shocked when I sleep too much. My body just says, hey, it's 7 hours, dude. You got to get up. It's time to go. Get up. Your brain's ready to roll. Let's get going. Get writing that book. Start doing something, will you? But I honestly think that if you don't develop an understanding of how do I manage my day?
Yeah.
Because the single biggest thing, maybe other than putting your seatbelt on, the single biggest thing that's going to help you live a long life and maintain a sharp mind is getting that good night's sleep. And you need to work towards that. And even for people when they work out at night, I realize some people can't work out until the evenings, but if you are going to work out in the evening, then you got to work a little harder to say, okay, I'm going to come down from that now.
Yeah, because that's another form of fight or flight.
Right, exactly. And even more important to get in that Epsom salt bath, take a deep breath, do that box breathing for 3 minutes and reset. Because I find that in addition to the need of, taking your nutrients, you've got to have a mindset that says sleep's a priority. Because what a lot of people will say is, I'll have plenty of time to rest when I die.
Yeah.
Right. But then
you're going to die sooner.
You're good. That's right. Hey, you're going to get to your goal.
Yeah. Exactly.
You are going to get to that rest point. But the other piece is we know that once you get past 8 hours of work in a day, once you start to push past the 8-hour period of work,
you're not making good decisions.
You don't make good decisions. You're not as effective. Yeah. And I don't know about you, but I'm always going to have something to do the next day. It doesn't matter whether I worked 16 hours.
The list is never done.
The list is never done. And so you've got to really start to prioritize. And by the way, one of the things that we're supposed to do, we should turn off in the evening. Enjoy our family.
That's right.
Enjoy our downtime. Get in the kitchen.
Hang up and hang out.
Yeah, cook. Cook. Get out in the yard. Do other things because that is going to allow you to really meet that circadian timing, bring down your nervous system, and by the way, make you a better person.
And it's what the centurions do.
Oh, yeah. Well, there's that.
Yeah.
It's an amazing thing when you look at that. The centurions have a balance. And we want to think about, it's the food they're eating. They
partly, but...
And part of it's true, or it's the 19-degree, if you're a Sardinian, the 19-degree inclines they're walking up every day at 85 years old. Partly. And then there's the socialization aspect of they eat together. They have a meal. You talk about your day. And now food's on the run. Even dinners are fragmented.
Right.
And it's all important to get back to
talking about work
piece.
Over dinner.
Yeah, exactly. Or you just keep going, right?
It's crazy.
Yeah, and so I think it's really important, when you think about sleep and you have a full thought about sleep, it is about understanding, one, I got to manage my stress. And that's easier said than done. We're living in, difficult times. People are working really hard in order to make ends meet. A lot of times there's families that are divorced. So now you've got two parenting situations going on. Right. There's a lot of social issues that get around that, right? But it's on you to say, I need to take control of this because if you want less wrinkles, get a good night's sleep.
Oh, we all need what?
Less wrinkles. We want less wrinkles, right?
There's a thing you were saying about the elderly and, as we age and in the elderly population, this sleep is a real problem. They sleep like 3 hours a night or so, but so much of it is lack of melatonin, but so much of it's the medications. And then it's a vicious cycle to your point because they'll get put on a benzo to sleep and then their memory's going. And then it's just this whole vicious cycle.
Yeah. And, when people are on benzos, I tell them to take some melatonin. They think, oh my God, aren't I going to be really groggy? Well, no, you're going to sleep. And to your point on using high-dose melatonin, I know when I was talking about high-dose melatonin years ago at A4M, people would look at me like, oh my God, I can't believe you're recommending this. Well, if someone's not hearing the megaphone, it's time to sleep, right? If you're not hearing it, you need to get a bigger megaphone.
That's right.
And so the way that I've always looked at it and what I found with patients is I may need to start them on a higher dose of melatonin, they can back it down. And many times they come back in and go, hey, you know what? I've been taking stuff during the day to calm me down. And I took your advice on doing that breathing. I haven't even needed to take that melatonin. And I'm absolutely fine. Great. As long as you're getting a good night's sleep. And I think if people start to work on that, they're going to find that they just feel more bright, more alert. They're going to manage their weight better. You're going to have less food cravings because the bottom line is the less you sleep, the more your brain says you need fuel in order to stay awake. And so people end up eating more and they reach for high energy foods and not necessarily nutrient
or hedonic foods.
orthodontic foods.
Or hedonic foods. Hedonic urges.
I thought of orthodontic foods because you're chewing your food, and then hedonic is right. Yeah, give me that sugar, right?
Yeah, exactly.
Yeah, because,
all right, so takeaways.
Right.
Okay, so sleep hygiene, number one. And what that looks like is paying attention to your day from start to finish. Don't just start thinking about it at 8 o'clock at night or 9 o'clock at night. Notice when that the gas is being pushed and not letting up. So what can we do to let up? Well, we can box breathe. We can take Qui-Calm, which is Relora, holy basil, and suntheanine. Right. So get Qui-Calm in a bottle or go on Amazon and get the separate
ingredients.
Yeah, absolutely. They're amazing botanicals. So paying attention to that during the day, and then really, I try so hard, and it's just difficult to get patients off their sleep meds. But if they can combine with their sleep meds some melatonin and gradually try to come down off those, that would be hugely beneficial. And then the light pollution. I can't, when I speak on melatonin, I spend a good bit of time talking about light pollution.
So important.
TVs in bedrooms should be out. Screens by your face at night should be out. And teenagers, for sure, I see this all the time. They fall asleep with their phones. They never get a good night's sleep because that phone is dinging constantly. And whether you realize it or not, that light that's behind your eyes is impacting your melatonin, right? And then now we have this huge depression issues with teenagers and anxiety issues in teenagers, and they're just not sleeping.
Well, and I know just in closing, because you mentioned teenagers, they need more sleep. And the problem that we have is they're being told, you got to take all AP courses.
Yeah.
And if you want to get into a good college, you got to have extra, you got to get the extracurriculars, and you got to do all the sports. And before you know it, they're running a more demanding schedule than you are.
That's right.
And so look, sleep hygiene starts at an early age, and you want to embed those values in your children. And if you're not a good example, they're going to be like, well,
you do.
You don't sleep. Why do I need to sleep? Right?
I have two questions, and then we'll go about melatonin. I heard, and I love Deanna Minnick. Love listening to her. She's a brilliant speaker, but she's passionate about melatonin too. She's very into phytomelatonins, which I read a couple of studies on phytomelatonins possibly being have more benefit. What do you say about that? I don't know enough about it to really speak to it.
I mean, honestly, I'm kind of I'm always more of a practical solution person. Regular old melatonin. Now, there's natural source melatonin now that's coming out. Phytomelatonins are coming out, but the melatonin that you get,
it works for me.
It works.
Yeah.
And so I don't worry about it too much. I think there's a lot of people that say, well, I don't take melatonin because then my body won't make it. Well,
yes, that's another.
Well, gee, your body already isn't making it.
And it's not I try to tell patients it's like other hormones. You know, your tank is about this full. I'm just filling it up. But if you'll give your body the things it needs to fill its own tank, you won't have to, put gas in it so often.
100%. Right. That's exactly right. Yeah. So, there's that. And then I know we didn't get to touch on it, but, a lot of people are using CBD.
Yeah.
Some people find it has, kind of reducing benefit the longer they're on it. You have an endocannabinoid system in your brain, and some of it is for your immune system. Some of it is for your nervous system. There's a reason, though, why it hasn't been really approved yet. And is some concern on long-term use of cannabinoids and its effect.
Right.
And so I think that, I think if it's working for you and you're getting a great night's sleep, great, but pay attention.
Yeah.
Are you really feeling rested over time with it? Because you still don't get away from the fact that where's my melatonin level at?
Yeah, that's right. And then last question, I have parents ask me this all the time or tell me, I give my 5-year-old a melatonin gummy every night, and so there's mixed reviews on that because kids by nature should be making plenty of melatonin, but then they swear by it that that the kids go down a little easier.
Right.
So what are your thoughts on giving children melatonin?
Well, the first thing is let's stress our children out less.
Yeah. How about that?
Let's start with that. Let's let our kids
get some screens away from them.
Let's get our kids being kids. Let them play more. Don't push them to work so hard. Yeah, get in the dirt, finger paint, all that good stuff. And don't worry about writing your third novel by third grade.
Yes.
And things will probably work out pretty well for them. And then also their diet. You know, when you feed your kid a bunch of sugar, guess what? They're going to get ramped up.
Yep.
And, you know, do I think, depending on if it's a spectrum disorder child,
yes,
that's a different story. That's a whole different conversation. But for the average child, I'd rather you don't have to use melatonin, that you try to use lifestyle instead. Mm-hmm. But on the occasional night that they're revved up and they're having trouble sleeping, if you wanted to give them a little bit of melatonin, okay. But let's try to solve the problem. Why?
Yeah.
Why is your child having trouble sleeping?
Kids should just hit that pill and be down.
Yeah. Like, is your home a little bit too excitable for them?
Yeah.
You know, what's going on? Like you said, what are they watching? What screens are they on?
What are they eating?
Do
they have to have dessert?
Things.
Yeah, the sugar lights up that brain like cocaine. You know, you've seen that in some studies. Well, thanks. That's a great conversation. Sleep's so important, and melatonin cannot be overstated.